Welcome to The Hill's Coronavirus Report. I'm Steve Clemons, editor-at-large of The Hill. Each day we are interviewing consequential international, national, and state leaders in the battle against the coronavirus. The world is waiting for antivirals and vaccines to eventually put a definitive end to the carnage created by the SARS-CoV-2 virus. COVID-19 is the disease that SARS-CoV-2 generates, and taking the virus down and treating the disease are the challenges at the very top of national policy priorities, not only in the United States, but all over the world. But once that vaccine or effective antivirals are discovered, and there is confidence in them, how many is enough? In America, we will come close to or surpass the 1 million mark in terms of those officially infected by SARS-CoV-2. Some public health officials believe that the real number of likely infected in America is probably more than 10 million. We're going to need scores of millions of doses for the U.S. The world will need billions of doses. That is a mathematical problem for the world because the production capacity to generate these number of doses doesn't exist at this moment in any coherent plan. Senator Chris Coons of Delaware has been one of the key behind-the-scenes shapers of the CARE and small business loan stimulus packages that are helping the unemployed, helping to shore up businesses, hospital systems, and states. And he helped craft a provision that focused exactly on the challenge of ramping up production of eventual vaccine and antivirals and getting $3.5 billion appropriated to do this. Senator Coons, thanks so much for joining us today. Let me first start and ask about Delaware, because I was reading that Delaware has had its toughest weekend this weekend with the number of infected and deaths. And I'm just wondering, how are you feeling? How is the state doing?
Well, Steve, I'm grateful for the very strong and engaged leadership of our Governor, John Carney, and our head of our Division of Public Health, Dr. Carol Rattay, because we finally recently got up-to-date test results about the breadth of the infection of COVID-19 in Sussex County, and in particular in the communities immediately around our poultry processing plants. Our number in terms of the number of infections has jumped fairly suddenly. And a number of us spent the last couple of days working to support the governor and our public health infrastructure and the hospitals in Sussex County to make sure that we've got the testing capacity and the treatment capacity needed to respond to this sudden surge in the number of cases in our southernmost county.
Now, you were one of the senators, you and I were just talking about Senator Bill Frist from really, 2005, 2004. Frist was out there basically warning about a coming pandemic, what we needed to begin doing and thinking about by way of protecting the American people. And that meant not only finding a vaccine that would protect us, but also scaling it. And lo and behold, Senator Chris Coons in the CARE package has been looking at this same question of how to scale quickly production of vaccines. In fact, I think you've said, hey, vaccines one piece of this, and the much bigger part of it is ramping up. Can you tell us what you've been focused on?
Well, Steve, as you may remember, I was the chair of the African Affairs Subcommittee on Foreign Relations and met with the president of Liberia several times in advance of the Ebola outbreak in West Africa in 2014, 2015, and actually traveled to Liberia during Ebola. I was the only member of Congress to visit West Africa during that pandemic. And it was a result of that direct engagement, that exposure to a country that was ravaged by a pandemic, where American leadership helped scale up a global response and helped strengthen the Liberian people's response to that tragic and challenging incident that got me very interested in pandemic preparedness and response. Bill and Melinda Gates have been real thought leaders, have really invested in this area. And as you just referenced, a former majority leader and Dr. Bill Frist, a former senator from Tennessee, is someone who was well ahead of his time in helping the United States think about and invest in pandemic response. BARDA is a sub-agency of Health and Human Services that makes strategic investments in biologic response and disaster response capabilities. And a number of years ago, they invested in 4 different facilities in Texas and North Carolina and Maryland, principally, that were designed to be sort of ready facilities to rapidly scale up large numbers of doses of vaccines or therapeutics. This was done in partnership with the Department of Defense, partly because there were a series of previous outbreaks, SARS, MERS, Ebola, and some concerns after the anthrax incidents in our nation's capital that we needed to be better prepared for a bioterrorism incident or for a possible influenza global pandemic comparable to what killed tens of millions around the world in 1918. So in the CARES Act, one of the things I advocated for was a significant increase in investment, both in currently available private sector capabilities and in strengthening the innovation and the flexibility of our nation's capabilities. One of the things I worked hard on, Steve, was so-called Manufacturing USA, which is a series of federal and private sector and academic partnership institutes around the country. And there happens to be one here in Delaware. It's called the National Institute for Innovation in the Manufacturing of Biopharmaceuticals, or it's better known by the more memorable acronym NIMBL, N-I-I-M-B-L. And it's not really just the University of Delaware. It is dozens and dozens of academic research institutes and private sector partners that all told have put together more than $200 million in investment in trying to be flexible and agile in standing up rapid and high quality responses to challenges like this current COVID-19 pandemic.
So are you saying that we should have confidence then that the manufacturing infrastructure for the pharmaceuticals we're going to need is there now? Can we just go to sleep, wake up, and this will all work? Or do you have concerns about NIMBL and the various related pieces of that working and getting the attention that it needs?
I have concerns that we need to invest significantly more for two reasons. One is that vaccine development is an exceptionally difficult and tricky undertaking. You have to have lots of quality control, both in the search for an effective vaccine and in the human trials, and then in the manufacturing of a vaccine. Second, there has never been an FDA-approved successful coronavirus vaccine. Coronavirus is an entire family of viruses. There's thousands of coronaviruses. There is obviously an annual flu vaccine, an influenza vaccine. So there is an existing backbone that is modified or developed every flu season. So how do those companies who manufacture flu vaccines do so? They work off of a known and approved backbone and then make adjustments every year because the flu mutates, it modifies. That's how it becomes newly infectious, is that it changes every year, every season. This particular novel coronavirus that is producing COVID-19 is a double challenge in that it is something that is going to require us to develop an enormous number of individual vaccine doses, and we're looking for a novel type of vaccine in that there's never been a successful coronavirus vaccine before. The private sector ramped up fairly quickly to try and develop and deploy a vaccine in response to SARS, which is also a coronavirus, but it never emerged into a truly global pandemic. So some of those investments that were made did not turn into a commercially viable response. So, you know, the private sector, which is where most of this will be manufactured in the end, needs partnership investments by government through HHS, through BARDA. And some of that has already begun to happen. There have been some awards in partnership with, I think, Janssen, which is a subsidiary of Johnson & Johnson, and with Sanofi Pasteur. But it's important to recognize that we're asking the private sector to take a lot of risk, to be prepared to produce hundreds of millions, even potentially billions of doses of vaccine when the vaccine development process is quite uncertain.
Let me ask you to jump ahead. You know, as a legislator in the Senate, and you work across the aisle, probably more than anyone else I know on the Democratic side. But when you look ahead, do you worry that we will forget now about the pain that we have got in place today, not think about the vulnerability that we have to these kinds of viruses? When I interviewed in the past Dr. Anthony Fauci, and when I talked to Senator Frist, they both have said we need to be proactive. We need to begin thinking about vaccine development across a platform, across a spectrum of possible risks for humans. And we're not doing that. We're very reactive, waiting for something to come gut punch us and not taking those proactive steps. Do you think this is bad enough that we will finally get the money that he and others are calling for to begin taking a longer term approach to virus protection?
I certainly hope so, Steve. One of the things that really haunted me during the 2014-2015 Ebola outbreak in West Africa was hearing that there had been a potential Ebola or Marburg virus vaccine in development in the CDC, in the NIH, but that it had been shelved due to budgetary constraints and budgetary concerns due to a lack of proactive investment in the development of a vaccine. As you know, there's been a significant Ebola outbreak in the northeastern corner of the Democratic Republic of the Congo that was grinding away last year. A key difference in last year's response to the Ebola outbreak in Central Africa to the 6 years ago previous response is that now there are 2 functional vaccines that are in trials that are providing critically needed protection to public health workers who are responding to the current Ebola outbreak. What's the point in response to this novel coronavirus outbreak? Yes, Steve, I think we will hopefully finally proactively invest enough, because as bad as this pandemic is, it is nowhere near as bad as what has been predicted for many years, which is that we are due for a truly lethal influenza pandemic. So COVID-19 is highly transmissive, like any influenza, and it is relatively lethal, but it is not very highly lethal. So imagine something that spreads as easily as the seasonal cold or flu, but is as lethal as Ebola. If that were to happen, we would face massive human losses globally, as happened in 1918, where tens of millions of people died.
Senator,
so I hate to draw your attention to an even more grim scenario.
Oh, you're saying this is a foreshock.
Facing.
This is a foreshock, is what you're saying.
That's correct. My hope is that this experience is bad enough that we finally mobilize globally the resources needed to ensure that we don't have to endure a pandemic like this one, but dramatically more lethal.
Well, I mean, it takes me to, potentially an uncomfortable question, but we are also in a political season. And as Americans are looking at President Trump and how he has organized the response of this, and you look at the presumptive candidate on the Democratic side, Joe Biden, who's also from your state, you ask yourself, would any president, would a Biden or would a Trump, how do they look at this? You're the one senator that went to Liberia and Ebola. That doesn't give me a lot of confidence that there's a depth of expertise in one of the branches of government. And so I guess the question is, how do we begin changing to look at something like Ebola or like COVID-19 as a national security challenge of the highest order, as opposed to one that's rather dealt with completely differently, and to look at leadership and how it gets the resources of a nation around this?
Well, Steve, remember that the 9/11 terrorist attacks on the United States were, for the vast majority of Americans, a shocking, utterly unexpected wake-up call. But for those who had been in the intelligence community, in our national security community, there were plenty of warning signs. There was a previous attempt at attacking the World Trade Center. There were attacks on the United States embassies in Nairobi and in Dar es Salaam in Kenya and Tanzania. There was the attack on the USS Cole. There were a whole series of attacks that showed that Al-Qaeda was becoming gradually more competent, more lethal, and more intent on killing Americans in a spectacular style. But we had a variety of challenges and problems in terms of our ability to gather the intelligence and respond in a timely way. The 9/11 Commission, after the 9/11 attacks, looked backwards at how we failed to be fully prepared for and respond to all of those clear signals. And so we gradually made massive investments in changing the structures of how intelligence is coordinated, changing the training and the doctrine and the preparation of our military forces to respond to asymmetric attacks by terrorist groups. We must do the same thing in response to this pandemic, Steve. We need a similar commission. that on a bipartisan basis we'll look at how our pandemic response was flawed, how this administration has failed to see the moment and to grasp it and to rapidly scale up highly effective testing, contact tracing, and then to manage the distribution of badly needed supplies, from personal protective equipment to ventilators to other critically needed material that would have made our testing and tracing more responsive. We will have a much longer recovery from this pandemic and many more lives lost to the pandemic than was necessary because of a disjointed and at times chaotic federal response. So my hope and expectation is that in a bipartisan way, moving forward from here, we will see a competent federal response inspired by a broad review of the ways in which the response to date has left many governors and many states struggling to find the resources and the response material that they need.
Senator, it's almost a great way to do it. I need to ask just as we end, because we did go through this bit of a surprising moment last week where the president had said that maybe if we somehow inject ourselves with disinfectants or take other strategy, we do this. So, obviously a question of, a lack of practical experience here. Do you think that that incident may be helpful now to get scientists more in control of the track we're on?
Well, any of us in elected leadership who served in executive posts get training in how to get out of the way. One of the things I've never forgotten about the training I got as a young county executive nearly 20 years ago about how to handle incident response was to be engaged and be responsive, but to also know what you don't know and to rely on the public safety experts, the public health experts to guide tough decisions. That's what our governor has done here in the state of Delaware. He's relied on critically needed professional advice and response. And that's what our president should have done, but frankly has not done, is to allow Dr. Fauci, Dr. Birx, Dr. Redfield, and others at CDC, NIH, and in the Department of Health and Human Services federally to inform and guide response. He should be at these daily briefings. Our president should be at these daily briefings briefly to introduce the experts and to provide them with the support and coordination they need, rather than using daily briefings as a several hours long running feuding session with the media that is utterly unconstructive. So my hope is that after this past week's disconcerting incident, that President Trump will allow his briefings to turn more towards the sorts of briefings that are science-driven, public health-led, and will help us move towards a more a fact and science-based federal response, something that all Americans need as we make very challenging decisions about how and when to reopen.
Right. Well, Senator Chris Coons, thank you so much for joining us today and sharing with us what it will take to scale up massive production of eventual vaccines and antivirals. Thank you so much. And thank you all for joining me here today. We'll see you tomorrow. I'm Steve Clemons. Be well.